Hi, my name is Brad Herskowitz. I'm a neurologist for the First Choice Neurology. I'm here today to talk to you about neurology in the current pandemic with COVID-19. First of all, our office is open. We are doing about half telehealth with patients, which patients can do from their own home or wherever they want at any location using their phone or laptop computer. That's worked very well, and I think patients are pretty happy, and it's been successful. I'm also here to talk about neurology in the hospital, and we're still seeing consultations in the hospital. We are seeing COVID-19 patients, and I'm also going to talk a little bit about COVID-19 and the neurological complications that we have seen and that have been reported. So there's a lot of information coming from China, from Italy, and even from the United States about the neurological complications associated with COVID-19. And it's been reported approximately 40% of patients have some form of a neurological complication. These patients often are in the ICU, but I'm going to talk about and differentiate between the central nervous system effect or complications, the peripheral nervous system effect or complications, and some skeletal muscle injury we're seeing. So some of the symptoms of the central nervous system, which would include generally the brain and the spinal cord, some of the symptoms seen are headache and dizziness. Some other more serious complications that have been reported and we have seen have been stroke. Now, stroke is very common in the general population. What's different with COVID-19 patients is that these patients are a lot younger, in their 20s, 30s, 40s, and 50s. So that's not something we normally see. Stroke patients normally have risk factors of high blood pressure, diabetes, high cholesterol, the older population. Again, these patients are younger, and we're seeing large clots in their brains, and the question is why? We're not quite sure, but these patients have a higher propensity to clot or become hypercoagulable, and when clots form, they can travel up to the arteries in the brain, interrupt the blood supply or oxygen to the brain, and cause the death of brain tissue, or otherwise known as a stroke. We are still doing the same type of measures, including TPA and also thrombectomy for these clots, where the interventional radiologist can go in to the arteries and take out the clot, and that's still effective, but this is something we have been seeing. Other things that can be seen with COVID-19 are just agitation and confusion, or another term is encephalopathy. That's pretty common in ICU patients and any patients with viruses, and especially elderly hospitalized patients, but it seems to be more prevalent in COVID-19 patients. People are confused, they're agitated, they're delirious. So these are some of the things. Other types of things that are seen with other viruses as well as COVID-19 would be encephalitis. Encephalitis is brain inflammation. Patients can present with headaches, confusion, seizures, stroke-like symptoms, and the MRIs will often show some brain edema or strokes, and that's called encephalitis or necrotizing encephalitis. There are different types. So those are basically the central nervous system complications that we see with COVID-19. Now, the peripheral complications are the peripheral nervous system consists of essentially the peripheral nerves and other things, but I'll talk mainly about the peripheral nerves. So one common symptom that I'm sure everyone knows about is anosmia or ageusia, which is inability to taste or smell. That's something that's pretty common. That's from the effect from the olfactory nerves that are on the undersurface of the brain that are involved with the sensation of smell and taste. Not sure exactly why what that is caused by, but it could be from direct involvement from the organism into the olfactory nerve. Other peripheral nerve effects are something called Guillain-Barré syndrome, which is inflammation of the peripheral nerves in the hands or feet, often in an ascending pattern, usually starting at the feet and moving upward proximally. This can be seen in the normal population. This can be seen with other viruses, may be more prevalent with COVID-19. Again, the symptoms are weakness, sometimes numbness of the arms or legs. If it affects the nerves in the brain, you can get difficulty swallowing, difficulty speaking, and you can even get shortness of breath that may require mechanical ventilation. So that's Guillain-Barré syndrome, and anosmia and ageusia are some of the peripheral effects we're seeing from COVID-19. Skeletal muscle injury includes muscle breakdown from the virus. When the virus affects the muscles, it spills an enzyme called creatine phosphokinase into the blood, and when this level gets too high, it can clog up the kidneys, thereby preventing the kidneys from making urine and functioning and filtering as they do, and that can lead to kidney failure and the need for dialysis. Excuse me. So that's something we're seeing as well. To our neurological patients, the ones who are immunosuppressed, perhaps the ones with multiple sclerosis, myasthenia gravis, neuromyelitis optica, the ones who are on immunosuppressants, it's important to really take precautions because you are definitely at higher risk for a detrimental outcome if you do in fact get the coronavirus. So please take precautions and be safe. To the patients who have COVID-19 or the coronavirus at home, waiting it out so we're not ill, if there are signs of confusion, of altered mental status, of slurred speech, or any signs of a stroke, these people should go to the hospital immediately because things can be done and procedures are in place to help those patients if in fact you're having effect of the central nervous system such as a stroke. So in conclusion, I would like to say that we are here for you as neurologists, both in the hospital and the office. We offer telehealth, which is working very well and very simple. I'm here in the office to see patients that want to come in who may require Botox or testing. And please be safe and be careful, take the necessary precautions. And thank you and have a great day and good luck.